What if one of the most common, cheapest drugs out there held a massive secret? I mean, a drug you might literally have in your own medicine cabinet right now. Well, today we're talking about metformin. And it's, well, surprising and kind of hidden war on cancer.
I know, it sounds kind of wild, right? A $5 pill, one of the most prescribed diabetes meds in the world, could be the future of cancer treatment? It seems like a huge leap, but that's exactly what we're going to dig into today. So let's get into it.
You could say metformin's story is a true Hollywood's second act. See, to really understand its potential against cancer, you have to go back, way back, to its humble beginnings as a treatment for something completely different. Yeah, metformin has been around for a long time. Its origins trace back to a plant called goat's rue, but it was officially put to use for type 2 diabetes way back in 1957. For decades now, it's been one of the most prescribed, most affordable, and safest diabetes drugs on the entire planet. It's really just been a quiet workhorse of medicine. Okay, so how in the world do we get from a simple diabetes drug to a potential cancer fighter? Well, the secret lies in this really fundamental connection between the two diseases. And it all comes down to their relationship with sugar.
This quote here from Frederick Banting, he was one of the guys who discovered insulin, it just frames the problem perfectly. Decades and decades ago, he saw this straight line connecting sugar consumption to diabetes. And it turns out we're now learning that very same line points directly at cancer.
And here it is, the crucial link. Type 2 diabetes, at its core, is a disease of metabolic chaos, right? It's often driven by too much sugar. Cancer, on the other hand, loves sugar. It absolutely devours it, uses it as its main fuel to grow and multiply like crazy. So they're basically two very different diseases that are feasting at the exact same metabolic table. Okay, to really get how this works, we've got to talk about two super important pathways in your body. First up is something called mTOR. Now, think of mTOR as the body's main growth switch, or like the gas pedal for your cells. When you eat, nutrients basically hit that gas pedal, telling your cells, all right, time to grow, time to multiply. The problem is, cancer is a master hijacker. It gets a hold of this system and just floors the gas pedal, keeping that mTOR switch permanently stuck on. Now, the opposite switch is called AMPK. Think of this as the conserve energy pathway, or the brakes. It gets turned on when you're low on energy, like when you're exercising or fasting. It tells your cells, whoa, hold up, stop growing. We need to conserve resources. And here's the kicker. Your body can't have both on at the same time. It's either MTR, the gas pedal, or AMPK, the brakes. And this brings us to the main event. How does metformin actually jump into this fight? Well, it turns out this humble little diabetes drug is basically like a Swiss Army knife against cancer. I mean, just look at how versatile metformin's attack is. First, it flips that master switch we just talked about. It hits the brakes, activating AMPK, which then automatically shuts off the cancer's gas pedal, mTOR. But that's not all. It also cools down inflammation, which we know fuels cancer. It cuts off other growth signals tumors depend on. It can even wake up the immune system inside the tumor. And on top of all that, it can directly trigger cancer cells to die, even going after those super tough cancer stem cells that are often the real root of the problem. And here's where it gets even more interesting. Metformin isn't just about lowering glucose. When your body's already in a state of what's called energy stress, low on sugar from something like a keto diet or fasting, metformin's cancer-killing powers get a massive boost. It goes from being just a manager to a direct, powerful attacker. So, okay, the theory sounds great. It's compelling. But what does the actual research say? Let's switch gears and look at the evidence and see where this is showing up in specific types of cancer.
Well, the results are actually pretty promising across several cancers. For liver cancer, studies are showing it can reduce growth. For some ovarian and lung cancers, it helps overcome chemo resistance. That's when cancer just stops responding to treatment. Metformin can help make the original therapies start working again. Then you have bladder and colorectal cancer, where it's been shown to inhibit growth and reduce the spread of cancer. So what this all suggests is that its real power might be as a partner therapy, something that makes our standard treatments just work better.
But, and this is a really, really important but, it is not a magic bullet. The story is a whole lot more complex, and to give you the full picture, we have to look at the cautions and the not-so-great results, too. So here's a crucial point. Cancer is incredibly smart and adaptive. Some research suggests that by slamming the brakes on the sugar pathway with AMPK, we might accidentally force some cancer cells to learn a new trick: how to burn fats for fuel instead. This really underscores why this isn't some do-it-yourself therapy. It absolutely requires careful medical supervision. And yeah, the evidence isn't a slam dunk across the board. In a big recent trial for breast cancer patients who didn't have diabetes, metformin showed no improvement in outcomes. And for endometrial cancer, the data's still pretty mixed. We just can't confirm that it works. It's a powerful reminder that cancer isn't just one disease, and what works for one type might do nothing for another. And look, like any drug that actually does something, metformin has potential side effects. It can lower your body's levels of vitamins B6 and B12. It can also cause low blood sugar or even low body temperature. Now, these are usually manageable, but there is one more serious risk you have to know about. It's called lactic acidosis. It is rare, but it is a serious medical emergency. So if you're taking metformin and you suddenly experience things like fast breathing, weakness, or nausea, you need to get emergency medical help immediately. And of course, it is absolutely essential for us to say that this explainer is for educational purposes only. None of this is medical advice. For any health decisions, you have to consult a qualified medical professional. You know, the story of metformin is just this incredible reminder that sometimes the biggest discoveries aren't about finding something brand new, but about seeing something really old in a completely new light. It really makes you wonder, what other secrets are hiding in plain sight, right there in our own medicine cabinets?